Word the president's coronavirus treatment includes supplemental oxygen and a powerful steroid raises questions about possible lung damage, something doctors find in a lot of COVID patients. The president's doctor not offering many details.
What do the x-rays and CT scans show? Are there signs of pneumonia? Are there signs of lung involvement or any damage to the lungs?
Yeah, so we're tracking all of that. There's some expected findings, but nothing of any major clinical concern.
Dr. Bruce Levy is the Chief of Pulmonary and Critical Care at Brigham and Women's Hospital in Boston. Dr. Levy, thank you for being with us today. Can you give us a translation as a layperson that Dr. Conley there says, nothing to be alarmed by is my translation. That's not the word he used. What did you take away from that?
Thank you, John. Pleasure to be with you. So typically, COVID-19 causes a bilateral viral pneumonia. And so the CAT scan or the chest x-rays typically reveal bilateral, what we would call infiltrates, cloud-like opacities on the lungs. And they usually cause this infiltrate in the very periphery or posterior sections of the lung. And it is a pretty typical appearance. So I think that's probably what the doctor was referring to.
Another episode in these questions and answers with Dr. Conley, initially they would not disclose this, and then we can listen here. We know at least twice, the president has needed supplemental oxygen. Let's listen.
Over the course of his illness, the president has experienced 2 episodes of transient drops in his oxygen saturation. We debated the reasons for this and whether we'd even intervene. It was a determination of the team, based predominantly on the timeline from the initial diagnosis, that we initiate dexamethasone.
Help us understand, number one, the significance and how serious is it that twice the president has had his oxygen level drops, and the prescription of the steroid the doctor just mentioned there, Dr. Conley. A lot of people have said that that's usually prescribed in more severe cases, although perhaps they're just being aggressive here because it's the president.
Thank you. The very large clinical studies that were done with the steroids in the setting of COVID-19 suggested that the people who benefited the most from them were the most critically ill, most severely ill. So in moderate to severe cases, we typically would consider giving steroids. And it could be that they're being quite aggressive with a more moderate severity. We typically would use criteria such as severe lung disease requiring supplemental oxygen. So the fact that he was requiring supplemental oxygen, at least periodically, would suggest he might be a good candidate for the steroid. And that's probably why dexamethasone was started.
And sir, in closing, if you twice required supplemental oxygen, you're on 2 experimental treatments plus a steroid, would you recommend that patient be released less than 72 hours after they came to the hospital?
That would not be typical if they're requiring intermittent supplemental oxygen. But that would be a recommendation to the general public.
Dr. Levy, grateful for your time today, sir. We'll circle back as we learn more about the president's condition and when